Hi everyone, my name's Raphael from EnergizeMeFitness. I'm an exercise physiologist and I've been helping pregnant women maintain their core strength and pelvic floor strength through exercise for the last 19 years. I'm based in Melbourne, Australia at Living Energy Pilates and Rehabilitation, which is my clinic which I started back in 2006. So during that time we've been continuously running Pilates and clinical exercise sessions for our pregnant and postnatal clients. My wife and I have had 3 kids during that time, and my wife attended pregnancy sessions throughout all 3 pregnancies just to make sure she had the best chance of staying healthy for herself and also for the baby as well. Now, one of the things I've learned during those 19 years is that one of the most common problems faced during pregnancy is pelvic instability, and that's really what I wanted to make the video about today, or make this little live stream about today. Pelvic instability is a term describing a group of conditions causing pelvic girdle pain, and symptoms often include pain in the sacroiliac joints, so the SIJs, pain in the lower lumbar spine, and pain around the pubic area, the pubic pain. And there may also be radiation of the pain into the hips or the groin. And it's a very common problem. While some pelvic girdle pain is sort of almost expected during pregnancy, serious pelvic girdle pain occurs in about 25% of pregnant women. And about 8% of those women get severely disabled from it. So they end up I've had a few cases where clients ended up in a wheelchair by the end of their pregnancy. Now, after delivery, most pelvic girdle pain does subside. However, significant pain does often continue for up to about 7% of women after the baby. So it's a pretty serious problem, and it certainly can be a pretty serious problem anyway. Now, pelvic girdle pain is caused, or thought to be caused, by the hormone relaxin, which creates laxity in the pelvic ligaments. And as the pelvic girdle adapts to pregnancy, it causes that pain. And it may also be not just from the relaxin itself, but it may be an asymmetry of laxity on one side of the pelvis. Now, pelvic girdle pain particularly occurs when we're weight bearing, and there's more force being applied to one side of the pelvis compared to the other, creating a bit of what we call a shearing force through the pelvis, where one side's sort of pressing down and the other side's a little more steady. So activities that become difficult because of this, are typically things like climbing stairs, getting in and out of the car, getting in and out of the bathtub, walking for long periods, even rolling over in bed. And the big question is, I guess, is that once you have pelvic girdle pain, what strategies can you put in place? What things can you do to help manage it? Now, I guess the first line of defense with pelvic girdle pain is what we call conservative treatment. So if you think of pelvic girdle pain, or the severity of it being a bit of a scale of minimal pain through to that severely debilitating pain, then the strategies that you put in place will vary a little bit depending on where you are on that sort of scale. Now, the first strategy that we'd want to put in place is exercise. Exercise can help maintain and improve your strength around the hips and pelvic floor, and therefore can help stabilize the pelvis and reduce pain. So I'm actually planning a whole nother video, because I want to go into quite a bit of depth in this topic, seeing as it is my specialty, but I'll go into depth in another video. But just to say a few of the basics are things like bridges. We want to do bridges, and lots of them, to help build up the strength of the glutes in particular. And also things like sideline clams are good to help build a bit of glute strength. In terms of pelvic floor, exercises like Kegels are your go-to. Okay, so if you're familiar with those, but as I said, we'll go through that in another video. Pilates-based exercises are very good for managing pelvic girdle pain as well. That's why I think Pilates is so popular amongst pregnant and postnatal women. And so is swimming. Swimming is really good because it's obviously non-weight bearing. Just one thing to keep in mind is with swimming is not to do breaststroke where you're taking the legs out and potentially opening up the pubic area of the pelvis and causing a bit of pain there. Now, the second strategy that we want to put in place is just generally to modify activities, our daily activities. For example, if we know, say we live in a house with stairs and we know that stair climbing is causing a bit of pain, then obviously we want to manage our daily routine so they're not having to go up and down the stairs all the time. You might have to shift a few of your possessions or your clothes and things downstairs. You know, worst case scenario, you might even have to sleep downstairs. But certainly organising your day a little so you're minimising the number of trips up and down the stairs would be really important. And when you're out shopping, say at a shopping centre or at work, if you work in a high rise or anything like that, then obviously taking the elevator or taking the escalator would be better for you as well. Now, another activity that can cause pelvic girdle pain is doing long walks, and walking is obviously really important for your mental and cardiovascular health. So it has a lot of health benefits. But often people find that if you're planning to, or your normal walk might be 30 minutes, but after about 15 minutes you're feeling a bit of pain. So what you can do is then basically break up the walk into, let's say, 10-minute segments. So you might walk for 10 minutes and then rest, find a seat somewhere for 10 minutes and then walk for the next 10 minutes and have a little rest. And that way you're managing your workload and you're giving your body a bit of a break from that sustained repetitive sort of movement. And then, just, I guess, being sensible with your activity in that way is really important. Now, the third strategy that can help you manage your pelvic girdle pain is to utilise passive support. So something like, you see a lot of these on the internet, is some sort of maternity belt will help manage that as well. So something that can cinch around the hips and support the pelvis and the lower abdomen can help reduce pelvic girdle pain. If you do a quick search on Google for maternity belt, you'll see lots of them on there. Probably the main thing to consider though is that if it's too tight, it can reduce blood flow around the hip area and even into the internal organs. So when you're wearing a maternity belt, not to wear it all day. So you wouldn't put it on and keep it on the whole time. So you would probably, or the recommendation is to just wear it for a couple hours at a time. So when you're being most active during the day, maybe when you're going to work or going for your walk or shopping or something along those lines, that's when you'd want to wear the belt. And then when you're able to put your feet up a bit at home, that's when you want to take it off. Okay, so they can be pretty useful. And they're not expensive. I've seen them for about, I don't know, maybe $50 or $60 on the internet. Now, the other thing I should mention too is that often you get these belly bands. So that's a belt that doesn't just go around the hips, it actually comes up over the tummy as well. And that might be useful if you have some lumbar pain, and it gives you a little bit more support through the abdomen to take some load off your lower back. So that can be quite helpful, but again, I don't recommend wearing that all day. Just for a couple hours at a time would be useful. Now, the fourth strategy is to utilise manual therapy. So someone like, your physio who specialises in pregnancy, your osteo who specialises in pregnancy, or your chiro, your manual therapist, myotherapist, someone like that. Someone who's used to dealing or working with pregnant women and knows their stuff in that area would be helpful. So manual therapy is good for relief, at least temporary relief of symptoms. So if you're in a bit of discomfort, then temporary relief, it can be really valuable. So that can be worthwhile. Now the fifth strategy is, and it's more of a last resort, is to utilize some sort of mobility aid. So if you're in severe cases of pelvic girdle pain, you might need to use crutches, or you might need to even use a wheelchair. I've certainly come across a few clients who've had to do that with, pregnancies. And it's not a nice way to finish, the pregnancy, or to have to get around in a wheelchair. It's never going to be a good thing. But if things are getting that bad, that might be when you need to really consult your doctor and see if there's anything else available beyond conservative management at that point. So I think that's pretty much it. I think I've covered it all. So, oh no, actually, I did miss one thing. Two things actually. Getting in and out of the car. So that can be a really difficult thing for pregnant women. And so normally when we get out of the car, we get out of the car one leg at a time and sort of pivot across and shift our weight across from one side to the other. But unfortunately, with pelvic girdle pain, that's exactly what you don't want to do. If you have more weight on one side, you're creating that asymmetry, you're creating that shear force, and you're going to irritate the pelvis. So when you're getting in and out of the car, try and have your knees together or close in together and pivot your whole pelvis and torso together. So you're turning your whole body as one. So you have to kind of swivel around it like that rather than take one leg across than the other. And that can be really helpful. So, and this also works with getting in and out of bed. Getting in and out of the bathtub. So again, just pivot both legs at the same time around, and try and keep your knees sort of, what we say is hip width. So let's say about 1 fist distance apart is about the right sort of distance. Now, keeping the knees that distance apart also brings us to rolling over in bed. So using pillows is really helpful for support. You can have a pillow in between your knees. It stops you from twisting around and rotating through the pelvis. And you can also prop yourself up with some pillows behind you to sort of discourage you, let's say, from rolling over too often in bed. You can certainly, if you look at pregnancy pillows on, again, Google search, you'll find lots of sort of pillows. They look like big U-shaped pillows where one long pillow comes down, you put it in between your knees to stop you from twisting or taking one knee away from the other. And then the other part of the U-shaped pillow sort of sits in behind you to sort of support you and stop you from rolling around. So that can be a worthwhile investment during pregnancy. And again, I don't think they're particularly expensive from what I've seen. Or you can just use a whole bunch of your own pillows. Certainly that's what my wife did during her 3 pregnancies. So yeah, that's about it from me today. So I hope you know a little bit more about how to manage your pelvic girdle pain during pregnancy. If you feel like you got something of benefit from today's video, don't forget to hit the like and subscribe buttons. And also, as I said, I'm planning another video on going into quite a bit of detail in terms of the exercises that you should do for pelvic girdle pain. So if you want to be notified about that, don't forget to hit the notification bell. We've also got quite a number of 30-minute pregnancy and postnatal Pilates sessions on our website, EnergizeMeFitness. So we'll leave details of that on the at the bottom of the description for the video. So feel free to check it out. I hope you got something out of today, and we'll see you next time.